This organization began in 1967. It was a time in Los Angeles where you had lots of young people. They were called hippies then, on the streets of Sunset Boulevard. It was, the heyday of rock and roll and free love, and a few folks got together and realized that you had all these kids and no one was really giving them any medical care, and so a couple of people got together and they started a little clinic to meet the needs of the patients and to provide the services free of judgment. But we've actually never strayed from our mission, and 43 years later we're here. It's a much different organization than it was in 1967. We have 5 different clinic sites, one of them at a school in Hollywood High. We provide about 90,000 patient visits to about 22,000 folks. And very different from the 60s, more and more people, we are their doctor. We are their medical home, and they count on us to be here year after year so they can get their services.
At all of our sites we do medical care, and then at 2 of our facilities we also do dental care as well. We do education and outreach and mental health services. So if a patient comes in and they need resources to food, clothing, or shelter, we always have a case manager on hand so that they can come in and talk to the patient right away.
On your birthday?
We have all of the medication that they need, but sometimes there's other things that we don't have, and so we have pharmacies in the area that they can go to, and we give vouchers, so everything is free when they come in.
At the clinic, there's no expectation of payment, but our patients are great. They make donations, and last year our patients donated over $100,000 to help pay for their care.
I was going to the Saban Clinic, the one on Melrose, and I found I was pregnant there, so they referred me to this clinic. It was really amazing to me how the doctors were just really amazing to be in a free clinic. That made me want to come back. Now we have Medi-Cal and everything, and I still come here. I mean, I could have my choice to go anywhere else, but I love the doctors. The doctors are really friendly.
We really realized and learned, I think, the lesson over and over again, that if you don't make things patient-centered, if you don't design systems that put the patient at the center and really meet the patient's interests and get them taken care of, those systems fail.
The data is quite clear that patients who have a medical home and are cared for by a care team that knows them over time, they have much better health outcomes. It also costs a lot less to care for them, even when you're working with a low-income population with a lot of psychosocial challenges in their lives.
We are involved in training the next generation of physicians, and I think that's really important because people get to come here and see these patients and see some of the issues that people have when you can't access health care.
This is small beating thing, this is the heart. Do you see it now?
It's very self-gratifying, especially with the youth that we serve. We advocate for them, they're an unspoken community. It's rewarding at the end knowing the work that we do and having that hands-on with the youth. But on outreach to adults, I mean, it's very gratifying providing a service that, that normally they may not receive.
I think we have a wonderful family type of environment. There's a team atmosphere. Everyone who's working here really has the mission in terms of being here to help others, to serve patients who don't have anywhere else to go. And as a result, you have a lot of camaraderie when you go home every day. You feel good about the work that you've done. I always tell people I'm never going to wake up and have a midlife crisis and wonder if the work that I did was meaningful or was important. You know that you're doing that every day.
And today, no shots, okay?
I like that.
Okay, Mama.
All right,
See you.
bye.
Bye-bye.
I don't think it matters what job you have. Every once in a while you have that day and you think, what am I doing? And all I have to do is walk down to the clinic and just walk the floor once. And you just go back upstairs and you do your work, because of course this is why you're here. It's for these people. It's for these people who smile at you, who walk by, who stop me and say, thanks so much. Thanks so much for having this clinic here. So it's really kind of selfish that I work at the Saban Free Clinic.